Are you a clinician that's hungry to get it right? Do you want to be able to walk into any room and feel like, hey, I can tackle any case that's in front of me? Hi, I'm Dr. Benjamin Fergus, and I'm excited to present a great 3-day course masterclass that combines our popular non-surgical hip replacement course with our classic grip clinical spine course. In this 3-day experience, you'll start with 1 full day mastering our non-surgical hip replacement. This is the most comprehensive non-surgical approach to treating patients with hip stiffness, pain, and degeneration, including osteoarthritis, cam and pincer deformities, and greater trochanteric pain syndrome. In this class, you'll learn clean assessment, including an orthopedic test cluster, some unique grip clinical orthopedic tests, and functional range of motion screens. You'll learn how to assess the capsule and the images and be able to speak very clearly with your patients about what's happening with their hip and what you can do to help it. Every test is actionable, so everything we show you will have a rehab exercise, a key soft tissue point that you can treat by hand, acupuncture, or shockwave therapy. We'll show you how to use radial and focused shockwave therapy and other advanced treatment technologies such as EMTT and blood flow restriction training. And everything you learn, you'll be able to plug in day 1 for exceptional results, being a game changer for patients with hip degeneration in your area. Take that plug-and-play system and work in depth in our Grip Clinical Spine course. The next 2 days, Grip Clinical Spine Day 1 and 2, will cover segmental evaluation of functional range of motion in the neck, upper back, lower back, sacrum, and pelvis. You'll have a crisp test you can do in any plane of motion. It'll let you know exactly what your client is missing, what your patient needs to overcome pain and restorability. You'll then take that test and plug in one of our GRIP Global Reset strategies. These are key rehab exercises that make fast changes in 90 seconds or less and can be programmed into home exercise strategies. You'll pair each movement with another crisp TSI area, a key treatment zone to open up motor control, range of motion, and pain-free activity for your clients. The whole system is designed to give you a clinical operating system. So everything you currently do can plug into the GRIP clinical operating system, but we'll give you all the tools you need to operate at a high level and become known as the hip or spine expert in your area. So join this exclusive 3-day course, 3 live days of information supported with a virtual catalog of quick reference guides, and take your whole skill set to a new level. I hope to see you at the course.